Good afternoon. My name is Matthew Broad. I'm the Director of Programs at the Trenton Health Team. If you are here for collaboratively constructing an index to measure the food insecurity in 3 New Jersey counties, you're in the right place. This project was made possible with support by the New Jersey Office of Food Security Advocates, and I am going to actually pass it over to Dr. Jenny Schrum from the office to say a few words about the project.
Thanks, Matthew. Hi, everyone. Jenny Schrum. I am the Research and Evaluation Manager at the Office of the Food Security Advocate. I am so excited that the Food Insecurity Index is getting launched. It's been months in the making, and I know several of you spent a lot of time giving input and helping really design what the instrument looks like. So first, I wanted to give a big shout out to the Trenton Health Team. Thank you for all your fabulous work. They kind of really grounded some of this approach in work that's already been done, but also adopting some of the language with the 6 dimensions of food security, which we really are excited to use as a framework statewide. And what I always say about the Trenton Health Team, the strength of them and what I value so much, and we value as an office, is how much they listen to community input. So this instrument is very much designed by stakeholders and input across communities in the 3 counties. So I think that's highly commendable. So shout out to you all. And I also wanted to say thank you to everyone who spent their time over the past few months coming to meetings, being engaged, interacting with not only the design of this and the approach of this, but with each other and having conversations about looking at data and what it means within the community context in which they work. So it definitely was a labor of love. So thank you all. And what I really wanted to highlight is how much this tool, I really look forward to it not just being a static thing that people reference once in a while, but it's very interactive. You can use it to have conversations with the coalitions you work with your partners you engage with your teams at work, to really look at information and one, maybe identify areas that you didn't know existed that maybe could use support or a different approach to programming. But also really just validate what you already know. A lot of you spend a lot of time in community and know what your community needs. And I think this data can really validate your understanding and give additional context to the approaches that you're taking. So thanks for having me. And this is a great day for OFSA in New Jersey to have some great tools and resources to use. Thanks.
Well, thank you for the kind words, and I do want to echo thanks for our steering committee. We had over 30 individuals representing Middlesex, Mercer, and Somerset County with expertise in food security participate on this project. A number of meetings throughout a number of different steps, which we'll get to talk about today. A bit of housekeeping before we jump into the presentation. We've enabled the Q&A function, so we will be taking questions throughout the presentation. If it is a short response, we'll answer the questions using that functionality. If it is a bit of a longer response, we'll hold those questions till the end. We are going to reserve about 10 to 15 minutes for questions at the end. We have about 40 to 45 minutes of content to get through. So with that being said, I'm going to pass it over to our GIS analyst, Em, to kick off the presentation.
All right. Hi, everyone. So welcome to collaboratively constructing an index to measure intensity of food insecurity in 3 New Jersey counties. So we're going to just dive in and kind of go over the process that we took to create this index, some of the decisions that were made, and then finally give a walkthrough of the index itself. All right. So our purpose as a team was to develop a multi-county food insecurity index to highlight the prevalence and distribution of food insecurity and create a model for the rest of the state. Right now, we're looking at a tri-county solution, but we want this to be able to be expanded to a statewide version. There is then the idea of where to focus, which was to identify which areas are the most impacted of food insecurity. And we did this at the block group level. And then what to do, which is to characterize the food insecure areas to indicate the challenges and needs to be addressed, because not all food insecurity is caused by the same reasons. We wanted to sort of address, all right, what is contributing to food insecurity in this area versus that area, and thereby influencing what strategies may be taken. So the key steps for creating the food insecurity index, we had to first assemble the variables. We identified and collected variables that potentially impact food insecurity at the block group level. We did this with American Community Survey variables, and we also did look at CDC places variables, though, as I will explain in a moment, they did not make into the actual index. We had to discuss how they and understand how they relate together. So understand the relationships between and among these variables and reduce the number to a more manageable set, because if you include every variable in the ACS or CDC places, you would just wind up with a lot of noise and not a lot of information. And then combine those variables to create the index. So create a single food insecurity index with a single value per block group that indicates the degree of food insecurity. And then discern differences between block groups with high index. So select the most food insecure block groups and create groups based on variables used to construct the food insecurity index. So define sort of the characteristics we described before in terms of determining why those areas are food insecure. So I'm going to walk you a little bit through the actual process of developing the index. So the data collection and variable selection was the geographic grain of the block group level based on the 2020 census data. Block group is sort of defined over at that graphic on the right. You have states, then counties, which are then divided into municipalities, census tracts, block groups, and blocks. We looked at the block group, which is a set of blocks. And we looked at 26 block group level variables from the ACS, as well as 12 census tract level variables from CDC places, such as diabetes, hypertension, and obesity. And all of the 9 variables from the original index were included in this variable selection. We then had to do our first set of reducing these variables because 38 variables is a lot. So we did some basic elimination. We got down to 20 by looking at local relevance, high correlation, which was more than 0.85% with other variables, and lack of a strong intuitive connection to food insecurity. So for example, we had both single parents and single mothers as a variable, and those had a correlation of essentially it was like 0.95 or something, as almost as close to 1 as you can get. So there was no point in including both of them in the final result because you'd essentially be counting the same variable twice. So we dropped that down. We looked at coronary heart disease. We looked at heart disease and decided, well, you know, while that could be related to diet, it's not really related to food security. So things in that nature. After that reduction, 2 critical questions remain, which was how do we further refine these variables? And how do we then assign appropriate weights for each retained variable? Because these various variables are going to contribute to food insecurity in different ways, and to different degrees. Like something like poverty versus disability may affect someone's ability to access food more or less. So we decided to reach out to our wonderful steering committee and submitted a survey asking them to rate each variable using 3 categories. So those categories were must include, maybe include, or do not include for these remaining 20 variables. We then assigned weights using the variable of 2 times must include plus 1 times maybe include minus 2 times do not include. So basically they were weighted higher or lower on the must or maybe, and weighted a little or on the must or do not, and a little bit on the maybe. So this allowed us to prioritize what were the most essential variables for calculating the food insecurity scores. So after we submitted this variable and we got feedback and there was a lot of discussion and great conversation, we wound up with these 11 variables grouped into 3 key themes. These themes were measures of need, measures of access to food, and demographic measures. So at the need level, we retained the variables percent of individuals at or below poverty level, percent of households using SNAP benefits, percent of housing cost burden households, percent of individuals without insurance, and percent of individuals on Medicaid. For access to food, we had percent of block group without bus access, adjusted for percent of households without vehicle access. This was calculated by looking at what percentage of the block group was within close proximity to a bus stop. So this was actually calculated separate from the ACS variables. This was something we did using asset data on bus stops. And then we also included in measures of access to food, percent of households with no vehicle access. For demographic measures, we looked at percent of household or percent of individuals with limited English proficiency, percent of households with a member age 65 up living alone, percent of individuals with disabilities, and percent of single parent households. So these were the variables that went into calculating the index itself. Now, these were not the only variables you'll be seeing today when we go into the index, because we did include other variables to characterize. For instance, in terms of race and ethnicity, we discussed extensively with the steering committee, and it was determined that we should not include these variables in the calculation of the food insecurity score because these measures were already strongly correlated with measures of need. And also, race and ethnicity are not by themselves drivers of any of the three themes that we selected for measuring food insecurity. But because they're important considerations when planning interventions, we did add them to the final data set to help stakeholders develop actionable strategies. So here's just a quick overview of the final weights. I'm not going to go through what each of these weights are, but basically after we calculated from that survey what the weight should be using that equation I mentioned before, scores with a value over 1 were kept in the final index. Variables that were not included in the index calculation were still used to characterize the block groups in the final map. So you can kind of see poverty and SNAP were sort of our leading variables in terms of what was felt by the team of experts to be the highest contributors to food insecurity, where perhaps something like bus access was a little bit lower, but still relevant. And you can see there's a whole spectrum of how different variables contributed. All right. So once we had this index created, we then had to map the index. So to actually calculate, we calculate a food insecurity score by summing those weighted values of the 11 selected variables. They were then adjusted to be on 100% scale, so we didn't have any like weird numbers, and it's just very easy to put things on a 0 to 100 scale for the sake of perception and understanding. Those scores were then mapped and shared with stakeholders from Mercer, Middlesex, and Somerset counties for review and feedback. This helped ensure that the results aligned with local realities and that the index was accurate and practical for use. There were some iterations done in terms of how we did the visualization for this index, and a lot of conversation in terms of how to best accurately represent the information in a way that's actionable. The final index is presented through an interactive map, which allows stakeholders to explore food insecurity levels across different regions. This ensures accessibility and transparency. There's also a lot of customizability and curation that can be done within the tool. And in a second, I will go over and show the Food Insecurity Index website. So one of the features of our original index that really made some impact were the clusters in the Mercer County Food Insecurity Index. These were areas where you could define why something was food insecure based on certain variables. We attempted to do the same thing for this map because that's sort of where we can kind of pinpoint the type of outreach and action that needs to be taken. In our original version, we used hierarchical clustering. Here we tried to use hierarchical clustering and spatial clustering techniques, but these methods proved difficult to scale across 3 counties, particularly due to the diverse needs of stakeholders. The clusters that came out may have been for variables that were entirely unrelated to each other, not very helpful for actionable insights, or were not very relevant to the organizations in those areas and how they need to allocate their resources and focus. So instead, we pivoted to focusing on specific population segments instead of clustering. This offered more targeted insights into the challenges individuals faced within each block group. So we identified resource needs. We defined 5 segments based on specific population challenges, which I will get into a little bit when I show the actual tool. And then there were scores that were calculated for each segment. This was calculated based on the Food Insecurity Index score times the variables that we were looking at for each segment. This allowed stakeholders to drill down into specific challenges within food insecure areas and tailor their interventions accordingly. Their segments, which we will get to in a bit. All right, so now we can dive in to the actual index. When you go to the index website, first off, does everyone see the index currently? All right, great. So this is the landing page. There's a lot of functionality on this website, but we did try to make it as accessible as possible. So there's a brief explanation of how to use this website and how to use these different pages. If you flip through here, we get an introduction to the issue, what is food insecurity, a link to the USDA government website explaining food insecurity and that information. What is food security with this definition from FAO. The Food Insecurity Index explaining the basics of what we've done, and a just quick snapshot of what the index looks like, and encouragement to continue investigating the site. So before we get into the actual index, I'm going to give a quick overview of some of the other features on this website. So say you came in here and you wanted to learn about food insecurity, you could first learn about the 6 dimensions of food security, as derived from the OFSA definitions. And basically we have each of the 6 dimensions of food security here and appropriate links. You can learn about the index. So here you can learn about how we originally started with creating the index, how this one's different. There's our timeline of how things were created, starting in March of 2021 through now October 2024. Hello. And then our process that you've already seen, the where to focus and what to do, that gets reiterated a lot throughout our process. We just wanted to include driving it home here. The index score, an explanation of what the score is, that it's developed to compare the likelihood of food insecurity at the census block group level, that a higher score indicates a greater level of food insecurity, and what that means. And the where, so if you're coming in and you don't know where Mercer, Somerset, and Middlesex is in relation to the rest of the state, there's some information here so that you can learn about where these locations are, and eventually we will make a version where this will all be highlighted. Block groups, not everyone has experience with block groups and what that means, so this is the same graphic as before, and just defining a block group as approximately 700 residents per block group, based off of the ESRI definition, and then a link to the original Mercer Food Insecurity Index. We then have our methodology. This is sort of a more deep dive into the methodology that we used, where our data came from. We again divide up in where to focus and what to do. So this is sort of the same information I just came over with all of you in terms of how we determined where to focus, how we retain the variables, and then what to do in terms of creating the index, what the different segments mean, which again I'll get into in a moment, but the segments are SNAP underutilization, homebound individuals, limited English proficiency, single parents, and transportation challenges. So basically showing all of this information, as well as links to the American Community Survey and CDC places for anyone looking for the raw data. And finally, our acknowledgements about the Office of the Food Security Advocate, their mission and vision, link, Trenton Health Team, again, link, and then the entire steering committee. Thank you to everyone. Shout out on this page. So these are the pieces of the website that you can see before you even get to the index. So once you want to start exploring the index, there's the initial index page. This shows a view of the 3 counties. You can briefly kind of see the outline of the counties. Mercer has solid lines, Somerset has dotted lines, Middlesex has dashed lines. You can pan, zoom, and scroll to see the map zoomed in or zoomed out. As you zoom in, you can see more and more details about roads, buildings, parcels, etc. And as you zoom out, it's a little bit more simplified. So this is just the regular index page. When you click, say, any block group, you get this pop-up, which says, this is a block group in this census tract located in this township of this county. It tells you the population and how many households. And then it gives you the entire food insecurity index score. So now you can see, okay, this scored a 58.79. There's also information for each of the segment scores. So you can see, okay, this has a score of 100 for homebound individuals and transportation challenges, 57.98 for SNAP underutilization, etc. And then it highlights which top block groups of the segments, or sorry, it highlights which segments this block group falls in for the top 10%. And that's top 10% of block groups in these 3 counties. You can then get additional information. You can look at each of the variables that are index scoring. So you can look at percent SNAP utilization, insurance, bus access, 65, those characteristics. But then there's also additional characteristics. So you can look at demographic characteristics such as Black and Hispanic. You can look at percent no internet, and then various CDC places health data such as poor mental health, diabetes, high blood pressure, and obesity. So you can kind of click through here and look at this and look at other block groups and get this information for any block group you're interested in. But if you want to learn more about just the segments, you can click to view any of these segments. Now, in order to use this tool, the layers that have the checkbox next to them clicked on are the ones you will be seeing. So for instance, if I have the SNAP underutilization segment score, I would not be able to then click what's underneath it with the homebound individual segment score. So just you want to make sure to click and unclick based off of what you want to see. So then this shows the same sort of information as before, but it does highlight a little bit more what the SNAP underutilization score is. But otherwise the rest of the information is the same. And we have this for SNAP underutilization. We have this for homebound individual segment. We have this for single parents. We have this for limited English. We have this for transport challenge segment score. Additionally, based off of popular request, we do now have it where if you click road labels, as you zoom in, you will see the names of roads, so you can orient yourself that way. That starts to default as off just to keep the map from getting too busy. Additionally, we have the functionality of filters. So say you want to know something very specific, like say you want to know the percent of Medicaid, that is greater than 25%, with a total population that is greater than 1,000. So you're looking for higher population block groups that have higher than 25% Medicaid enrollment. You can click this and it turns on a filter and you'll see just the block groups that fit that characteristic. And then again, you can click in and learn about them. You could also say if you wanted to know about very specific, you know, let's say you want to know something, had a little pop-up. You want to know based off of the different segments. So SNAP utilization is, you know, greater than a score of, let's say, 30. And then you also want to know the amount that has lacking transport that is more than 20. Well, apparently that's no scores, but let's make this something more reasonable. You could then see which scores have those overlaps by toggling this switch on and off, and you can run that same calculation for any of these different segment scores. Additionally, you can export the data. So if you have people on your team that really want to look at these raw numbers, you can export your data to a CSV and have everything in a spreadsheet that has all of the data for every block group. Also, if you do have a GIS team working in GeoJSON, and JSON is available as well. You can also run basic statistics. So if you wanted to know, let's say, percent disability, it would tell you what the minimum, maximum, and average is for these 3 counties. So that gives you a little bit of data of how you use this. So click on and off what you want to see. Use the dots to do some more power user work. But otherwise, the information's here. The legend will pop up with whatever is showing on the right. The darkest of, so for all the segments, you may notice that there are 6 categories. The darkest segment is the top 10%, and then it goes, you know, 80 to 90%, and so forth, 70 to 80, 60 to 70, 50 to 60, and then below 60%. And that is how we did that for each of the segments. We just felt that being able to see the top 10% gave a reasonable number of block groups for the counties to perhaps focus on as needed. On here, you can also pop right back to the About the Index page. And let's see. So then there's the county view. You can either tap down with the individual caret to see each of the counties, and then this has all the same information. Or you can go to the county view page and click from here. And we have that for Mercer, Middlesex, and Somerset. Also on the main page, there is, again, the ability to navigate to the right to learn more data. So this shows you each of the segments. It explains what the segments are, and what their legend is, so that you can very quickly see what you're looking at. And so you can know, like, for instance, this is SNAP underutilization, so you can see that matches with that legend and explains that it highlights areas where there appears to be an underutilization of SNAP resources. At the block group level, this measure combines food insecurity score, percentage of individuals living below the poverty line, and percentage of households not receiving SNAP benefits. And then there's also, we have this table here that shows what measures were used in the food insecurity score, as well as the additional characteristics. And if they are above the New Jersey average, they are highlighted. So if there's, say, a higher percentage of households with no access to a vehicle in Mercer County, that's highlighted. And that goes for every variable. On the segment page, there's also, you can have a link back to our methodology. We also have an explanation of these segments just in terms of their basic variable usage. So talk about how, as we said, staff underutilization, all of these are areas that are already highly food insecure. And then it's also for the areas that are going to have high levels of the top 10%. They will be these variables plus food insecure. So we have the SNAP underutilization, which is households not using SNAP benefits and individuals at or below poverty line. We have homebound individuals, which feature individuals higher likely to be homebound. So this is households with members 65 plus living alone and individuals with a disability. We have single parents, which is percentage single parents, this as well as food insecure, limited English proficiency, which is percent individuals with limited English proficiency, and food insecure insecurity score, and then transportation challenges, which is households with no vehicle access or block group area with no access to bus transportation within 0.25 miles. And again, all of these are with the food insecurity. So that's sort of the overview. And obviously you can look at your own county, and when you do the statistics, etc., it will just give it for your county rather than for all the counties. So that's the difference here, and the filter will just be for this county. But otherwise those views are the same. And then there's a contact us form. If you run into any trouble, have any suggestions, you can use this form and it will get right to us. So that's the overall. Let's see if there's anything. All right, so back to here. Now we are into the segments that I gave a brief overview for. Kathleen, would you like to jump in and take us away with segment discussion?
Yes, thank you. And thanks for your run through of the tool. We're really hoping that that tool is easy to use, but as Em said, please message us through that contact form, or we have more contact information at the end of this slideshow if you run into any issues or have any suggestions for making that tool even easier to use. So for what we feel like is a really key part of the functionality and actually like applicability of this tool, the segments. To underscore what Em has already said, we initially tried to do something that was more of a clustering methodology, which was trying to group like block groups together and come up with, one overall description of what that group of block groups could be like. But we were just realizing that was not helpful from the feedback we were getting from our steering committee and our stakeholders. And so we moved to this approach that is focusing on specific potential, needs for specific populations. And we heard from our steering committee that this was more helpful in terms of planning outreach strategies. One of the awesome things about this approach is that one area, one block group could be high in multiple of these descriptions. And that just gives you more layers of information in order to plan your strategies. So, for example, you could have an area that has a high score in the SNAP underutilization segment and also a high score in limited English proficiency. And that would tell you that if you want to do some kind of outreach in that area related to SNAP, you should also be mindful that there is limited English proficiency in that area, and you'll want to have, staff people who can speak the language that's spoken in that area. You might want to have resources that are available in multiple languages. All of these information is just there to try to help you in terms of planning out ways to actually be effective in your strategies. So if you can go to the next page. We have some practical examples of how you could use these segments. These are some examples that came up just in our discussions with our steering committee. Certainly not the only way you can use these segments. And we'd actually love to hear if you end up using this tool and using these segments in a specific way, how you use them. So that way we could all learn from each other. But let's just go through a couple examples. So for SNAP underutilization, let's say an area has a high SNAP underutilization score. Maybe that's an area that you want to target SNAP outreach events and have SNAP navigators there to help people sign up. This is an area that, based on the variables that we use to calculate the score, has people who are potentially eligible for SNAP but are not currently using it. So that could be a great opportunity to do some targeted SNAP outreach. For the homebound individuals segment, that's a higher concentration of people who may not be able to get out of their home, whether it's due to disability or due to being older and living alone. And so that could be a good area to target meal delivery programs. For the limited English proficiency segment, that is an area that has a higher concentration of people with limited English proficiency. And so, as I was already hinting at a few moments ago, that might be a place to prioritize having some bilingual staff, having resources available in different languages, and even having different culturally preferred food available if you are actually giving out a food resource. Just something to be mindful of as you're planning. For the single parents segment, if there's a high score there, that's an indicator that maybe there's people who are time constrained in that area. If they're single parents, maybe they're working multiple jobs, have to get their kids to school. And so it could be a good idea to co-locate food resources in schools, libraries, or other commonly visited areas, just to make that be, remove one step of the process for someone to be accessing the food resources. And then finally, for our transportation challenges segment, that's an area where there's a higher concentration of people who do not have access to a vehicle and who may not have access close by to a bus stop or a bus line. And so that could be an area to target some mobile food pantries, and maybe in the longer term, making some more brick and mortar locations in that area, because there is that transportation challenge that seems likely for those residents. Okay, I think that is the end of my examples I wanted to share. So we got a few questions in the Q&A already. I'd love to open it up to any questions, any comments, honestly. As Dr. Jenny Schrum said in the very beginning of this webinar, this was a very collaborative process. And so we're still always looking for feedback, and we'd love to hear ideas for ways to improve this. We know there's going to be no perfect tool, so we want to just keep iterating and improving this as we go. So I'll open it up to questions now.